All right. Hey, happy Wednesday, everybody. This is Dr. Sean McWilliams from Back Talks, where I come to you every Wednesday to help support you in your spinal health journey. What a pleasure to have you here. I'm going to flip over to this so I can say hi to everybody and just do some tests. So, hope you're doing great today. It's a beautiful day here in Georgia. And just making sure our chats work. And hey, it looks like we're working there. So, hey, great to have you here. So if you've been following us, you know for the last 3 weeks, we've been doing an entire series on different types of invasive procedures to help people manage pain. So we started off week 1, epidurals. Week number 2, facet injections, and this week we are going to be talking about ablations, nerve ablations. So, but before we do that, I want to talk about, we're a family and a culture of people that are looking for a natural, holistic approaches to managing their spinal health and spinal pain if they're dealing with that. We're a culture of people that don't want to be taking drugs and being on narcotics. And living on medications and going to get injections just to be able to have somewhat of a normal life. So we're a culture of creating and sharing with you and inspiring you to know that you have the ability to manage the majority of spinal issues if you're in pain holistically and naturally and from the comfort of your home, believe it or not. And you can also keep it healthy from the comfort of your home as well, and we teach you how to do that. So let's talk about nerve ablations. So nerve ablation, what is a nerve ablation? Let's talk about it. I want you to understand, I always try to come from a biased person or an unbiased perspective of what they are, understanding the benefits to you, understanding the risks to you, and then also, do you have other non-invasive procedures that you can do and options for yourself that are much safer, I think. So let's take a look. So what is a nerve ablation? Let me bring this up so you can read it there. So a nerve ablation is a procedure that destroys nerves in the area of pain. Bam. So as you can see over on this left-hand side right here, and I'll show you how it works, they're going to use a special needle that is going to send an electrical impulse going down into basically like a hollow straw, metal straw, and I'll show you that picture. And the point of this is to kill the nerve. So, and what they want to do is they want to destroy the nerve, hoping that the pain signals will stop. Are there benefits to this? For some people, there are. But one of the biggest things, that I want everybody really to remember is that if you manage it this way, you're not doing anything to improve the biomechanics of your spine and your discs and your facets. You're just killing the nerve temporarily, and the nerves regrow. So you'll have to get this done again and possibly again, depending on how long it lasts, and with the hope that you don't get worse in the process of it. So keep that in mind when you're doing thinking about ablations. So how is it done? It's done similar to, well, it's done just like this, to be honest with you, not similar to. So you would be in a surgical room. They sterilize your back. They're using this machine right here, which is called a video fluoroscopy machine. And the image that takes winds up going onto the screen, as you can see right here. And so that doctor is going to be guiding the needles that he's putting into your back. And it'll look like, come on. Oh, sorry about that, guys. So it looks like this in the close-up. So he's on this left side, he's inserting a needle, he's getting it into around the facet area, typically looking for the medial nerve branch that goes around the facet joint. And then once they find that, then we go over to this side right here, you can see, and now there are special needles that are hollow. And then this wire is set up to a machine, and basically what it's going to do is it's going to send a frequency through this wire. It's going to go down into this catheter that goes down into this hollow needle to your nerve. It heats up the nerve and it destroys the nerve for a period of time. And the goal is to hopefully help you have no pain or reduced pain. So that's how they work. It is a more invasive procedure than a facet injection because you're going in and destroying the nerves, as you can see in this picture right here. So here you can kind of really see it right here. So you have this hollow tube right here that goes down through your skin all the way into your spine, and then they insert this piece right here, and then this gets heated up, very hot, and then it, with the hope that you're going to burn that nerve apart so you don't feel anything. That's how nerve ablations work. So if you're considering getting it, that's what you're going to be dealing with and going under. Okay, hope that helps. So are there benefits to this? Yeah, there are. You know, I very rarely send people for this, to be honest with you, but I know people that have had it done in my practice over 24 years. It can provide some long-term pain management, and they say up to 2 years. I don't see a lot of people personally that have had that type of pain relief from these. Most of the time it was more temporary, usually a couple months. But you got to realize though, you know, you're making a decision for pain management while your facet area is still going and is still in a state of inflammation and disease, and it's giving you a signal of pain for a reason. So, you know, you can just go numb it if you want. But the problem is that you still have the disease process there. So, you know, we look at it in our culture as looking for healthy ways to approach this without killing your body in the process, and actually supporting your body in the process, getting more blood supply into that area, reducing irritation to these nerves, reducing stress onto the nerves and the facet joints and the discs. And you can do that naturally. So I want you to know that, okay? And with amazing results. So let's look at this next slide here. So they use a radio frequency to provide pain relief. Some of the research says up to 2 years. You know, I think that's kind of all over the place, just depending on who you ask. So are there any risks of doing nerve ablations? Well, there are. You know, most of the places say that that's pretty low, but permanent nerve damage or pain can occur. So you got to remember that. Permanent. Not what you want. You're not going to get permanent nerve damage with what we're going to go talk about here. But anyway, I'm just trying to be relatively unbiased about this. That's how they work. That's what they do. You see the procedure on what you go through. I'm just realized that there are some risks involved as well. There are some other complications. You can get an infection if the people don't sterilize your back really well, or if you have a weak immune system, and bleeding typically from the needle insertion site. Okay? So do you have other options? Well, you do have other options. You know my stance on spinal decompression. If it's either computerized spinal decompression, if you're going to an office to get it done by somebody who's certified in it and actually knows what the hell they're doing, or doing it at home with the guidance of somebody that actually knows what they're doing and can teach you how to do it from home, which is really, I think, your best option. It's the most comfortable option. You don't have to get in a car and go anywhere 3, 4, or 5 days a week. The cost is much less, and you can do it in an environment that's comfortable for you. So, you know, you make your initial investment for learning how to do it in a piece of equipment, which is under $1,000, and you can be doing this from at home and having amazing results. So I want you to know that, okay? I love reading research. I read a lot about it, so I can bring you amazing information. So this is a study that I was reading today. So this is the Gauss and Naozaki study. This was in the Journal of Neurological Research. I put you on here so you can see this a little bit clearer and get my mug off there. This is volume 20, number 3, April 1998. This is the percentage of spinal mobility, pain reduction, and activity for these patients after doing spinal decompression. So these are all where people are in pain. So let's take a look at this. So 70 mobility, the ability to just move like we're supposed to, 71% improvement before they did decompression to afterwards. That's pretty amazing if you ask me. Their pain was reduced by 71% as well. Their activity levels was 78% improved. These people got almost 80% of their life quality back by doing decompression. This is no injections. This is no going and being in a surgical room and anesthesia and getting your nerves killed. It's amazing to me. And here's pretty cool, pain remission. So that means people that had pain relief, it stayed in remission for 77% of the people. How can you argue with that? I'm going to let you know, spinal decompression should be your first line of defense when it comes to this. Not number 6, 8, 20. Should be number 1, because doing spinal decompression can manage facet arthritis, facet pain, facet compression, bulging discs, herniated discs, spinal stenosis in the cord, if it's usually the disc that's creating the stenosis or the narrowing of the canal for the spinal cord to go through, or for IVF encroachment, which, if you don't know what that is this part where your nerve branches come out. There you go, hopefully you can see it. So it's this hole right there where that nerve comes out. That whole oval structure is called the intervertebral foramen, or they'll call it the IVF. So you can get stenosis here, like you would see here. So you can see how little that hole is right now for that nerve to get out right there versus how big that one is. So this is how we're supposed to be when we're healthy. This is what happens when degeneration occurs. But the beautiful part is, spinal decompression, you are improving the mobility, and you can start to very gently and comfortably start to create more space for that nerve to come out. So it's not getting choked like that, like it was there, like in a vice grip. So, man, you can't do that. You can go in and get surgery, you can get decompression surgery, but I'll tell you, most of the ones that I've seen done, I don't really see that much of a difference on a post-MRI, and yet I can show you hundreds of people in their MRIs pre and post after 12 weeks of doing spinal decompression, and it'll blow your mind. Last 2 weeks I showed you some pre and post of our patients too, so I want you to keep that in mind, that you have that as an option. But if you go to most of your surgical centers, they are not going to even talk to you about it. It's not going to be an option. You're going to go through exactly what we talked about, either epidurals, facet injections, ablations, microdiscectomies, or fusions. That's what you're going to get offered, because that's where all the money's at. And so you got to be a really educated, savvy consumer to know what your options are, and you do have other options, and I hope that I present those here for you as well. So keep an eye out for Disc University. We'll be launching that here in the next 3-4 weeks. We're super excited to do that. It is a course that I created over the last year. I worked really hard to teach you how to do spinal decompression from the comfort of your home. So you don't have to worry about, is there a doctor in your community that knows how to do it? Do they have the right equipment? Do they have the right training? You got me, one of the top spinal decompression doctors in the entire United States, and I teach you how to do it from your home for a fraction of the cost. So I can't wait to share it with you. If you know someone that's suffering with spinal pain, please, I hope that you share this video with them and our other ones. I hope they feel informed. I try to bring you really great information. I hope I add value to your life. That is definitely my goal. And keep an eye out for Disc University. It'll be coming soon. We'll be having some discounts too on it. So super excited to help y'all. Thank you so much for joining us. I'll see you next Wednesday, where we're going to be talking about microdiscectomies. What is a microdiscectomy? Are there pros to it? Are there cons to it? And do you have other options as well? So thanks for joining, everybody. I love and appreciate you. I'll see you next Wednesday at 1 o'clock.